Good afternoon, and welcome to today's webinar entitled Health Risks of Isolation and How Restore Helps. My name is Ian Oppel. I'm an occupational therapist and the Chief Clinical Officer with Restore Skills. I've worked in healthcare for 25 years, with 20 as a dementia-capable certified therapist. I'm a passionate advocate for our most vulnerable population. I would like to be clear about today's webinar topic, as the coronavirus, COVID-19, is currently the dominant headline in the news. This webinar will not directly address coronavirus containment strategies as related to isolation or quarantine of infected or at-risk persons, nor will we review hand hygiene, cough, sneeze etiquette, transmission-based precautions, or visitation best practices. I would like to direct you to the World Health Organization, Centers for Disease Control, state departments of health, and your healthcare center as the resources producing policies and procedures related to that content. In today's webinar, we will be discussing a potential unintended byproduct of the coronavirus, social isolation, a condition which already affects 1 in 5 older adults and is at risk for escalation. The learning objectives for today's webinar are to better understand social isolation and its involuntary causes, to better understand the physical, cognitive, and psychosocial risks to patient health of social isolation, and how Restore's gamified digital skill building platform can help mitigate those risks, to better understand the effects of facility staffing and resource challenges, and how Restore's multi-user, multidisciplinary capable platform can support those challenges. A quick overview of Restore. Restore is fun and engaging, gamifying therapeutic skill building sessions and accelerating patient outcomes, which may be tracked. Multiple team members from therapy, nursing, activities, and more can access games and activities helping patients with mobility, range of motion, coordination, cognition, activity tolerance, and life skill readiness simultaneously on as many devices as available. Restore is a HIPAA compliant platform that operates on most devices, laptops, and tablets with an internet connection, webcam, and controllers which can be virtually any red, green, or blue rounded object. Controllers can be disposable, left in rooms, or cleaned according to guidelines. Restore is telehealth capable and remote monitoring enabled with informed consent. Social isolation may be defined as having limited contact, poor quality contact, or no contact with other people. It affects 1 in every 5 older adults and may be episodic or chronic. Social isolation may be voluntary, but most instances are involuntary. Not all people who are socially isolated are lonely. Social isolation differs from loneliness in that loneliness is a state of emotion felt by individuals who are not satisfied with their social connections. You can be lonely in a crowd, but not socially isolated. Both can be painful experiences and have a harmful impact. Social isolation is associated with higher risk of mortality in adults aged 52 and older. There are many contributing factors to social isolation. Let's take a look at some of the more common involuntary causes. Risks of social isolation increased with advanced aging and changes in social roles. Retirement, unemployment, or an inability to perform a job at a previous level may be a catalyst, as many of us spend the majority of our days working. Transportation issues can become a significant factor if no longer able to drive, or an individual who may lack confidence walking in the community and be unaware or lack access to community resources. Shrinking networks of friends, family, and acquaintances, most significantly the passing of a spouse. Short or long-term illnesses or injuries may spur physical and cognitive disabilities, limiting or preventing societal engagement. One example I'd like to share related to sudden onset of illness that may go unnoticed or have delayed reactions from the care team is when I worked in long-term care and assisted living. As a therapist, I would lead an activity group once a week. It was always a challenge to work with a diverse group of residents with varying cognitive and physical abilities. If the activity wasn't challenging or interesting enough, the higher functioning residents would try to leave or escape as if it was Alcatraz. If the activity was too challenging, the lower functioning residents would fall asleep. But most concerning, and something I had to train myself to look for, were the residents who were regular attendees and participants that were absent from the group. It was hard to focus on those who were not there, but as weeks went by and absences were increasingly noticeable, I realized how important it was to follow up. What I found was that the absenteeism was often involuntary due to a medical condition that limited attendance. The illness had an impact on mobility, activity tolerance, and subsequently self-care, not to mention behavioral health factors such as depression. Attendance tracking and elevating absenteeism concerns to the care team should be a high priority. For those with caregiving assistance in the community, economic struggles and/or changes to support structure can occur quickly and unexpectedly. Solutions almost always take time and resources which may or may not be readily accessible and available. Epidemics and pandemics such as the COVID-19 coronavirus are a very real risk to escalating conditions which can lead to social isolation. Visitation and travel restrictions, quarantine of potentially exposed individuals and groups, increased burden to caregivers may drastically reduce the necessary contact for vulnerable individuals, leading to a downward spiral. We're now going to discuss the physical, cognitive, and psychosocial risks of social isolation. But as we do, I'm going to discuss ways in which Restore can help mitigate those risks. Let's begin with physical risks. Involuntary social isolation is often coupled with sedentary behavior or extended bed rest. Muscle weakness has a rapid onset in these instances, where skeletal muscle may decline by 1 to 1.5% per day of rest. Increased bone loss and decreased bone density heightens risk of incurring a fracture with a fall or near fall. Skin thins and shears easily, heightening the risk for skin breakdown and pressure sores, especially if self-care and hygiene practices have lessened. Inactivity adversely affects almost every system in the body. The cardiovascular system is impacted by decreased stroke volume and cardiac output, high blood pressure with an increased risk for heart disease. The respiratory system is impacted by diminished respiratory excursion and oxygen uptake. The GI system has challenges in the form of malnutrition, constipation, and there's a higher risk for incontinent episodes. Senior isolation is neither inevitable nor irreversible. Individual and group exercise programs are a wonderfully effective way at reducing isolation and loneliness in seniors. Restore is a portable skill building platform, so it can be brought to resident rooms via laptops, tablets, accessing the internet. Because it's web-based, you can have multiple team members utilizing Restore with residents at the same time. Team members have unique logins and passwords and won't disrupt gameplay on another device. Games and sessions are fun and engaging, yet focused on functional reach, range of motion, coordination, mobility, balance, activity tolerance, and life skills such as medication and money management. Players can experience the feel of virtually pulling a slot machine handle to win a jackpot, skiing down the slope of a World Cup race, or controlling the flight path of a plane in the comfort and security of their room. And this may be the start of developing a trust to help expand their social circle to outside the room. Players and team members become immersed in the activities, while Restore collects and tracks outcome data, which may be shared to encourage progress with treatment plan goals. Now let's look at some of the cognitive risks of isolation. Seniors who suffer from isolation have a 64% higher risk of dementia, symptoms which impact cognitive function. Isolated older adults may experience a shortened attention span and not feel the need to remain aware and alert, which increases the risk of elder abuse. There may be an increase in forgetfulness, and challenges to maintain reality orientation, losing touch with who they are, their surroundings, and time, be it the season or the year. Safety concerns emerge from a loss of trust and self-confidence, resulting in poor judgment and environmental safety awareness. Overconfidence may be a safety factor if individuals are attempting to be more capable than their current abilities. Care approaches should be person-centered and commence with a concentrated effort to gain trust and agreement. Take time to familiarize yourself with the individual's interests, preferences, habits, tendencies, work history, family history, and so on, and incorporate those into your approach. Limit unnecessary stimulation of the environment. Noise, television, lighting, if there's hallway traffic, closed doors. Don't rush. Position yourself at eye level. Speak calmly, slowly, and allow time for responses. Restore has a diverse selection of games and activities, so you can take the time to make a meaningful selection based on known interests such as sports, food, music, art, animals, so on. Game and motion settings are customizable, so they can be individualized based on cognitive and physical ability levels to find the just right challenge for experiencing success and not frustration. Restore games and sessions promote cognitive skill building with attention, concentration, memory, problem solving, judgment, decision making, sequencing, and safety recognition. The content is updated routinely to assist with reality orientation and trust building. Launching this week will be games with a St. Patrick's Day theme, Jackpot of Gold with slot machine images related to the time of year, promoting name recognition and reminiscing. And Leprechaun, Leaping Leprechauns, I think we're going to go with. A competitive contest where two leprechauns are vying for each other's gold. Think of it similar to air hockey. We've touched on several of the psychosocial risks throughout the presentation. Increased prevalence of anxiety, onset of depression, or demonstration of unwanted behaviors. To note, the rate of depression for seniors who live in residential care facilities has been reported as high as 44%. Loneliness accompanying social isolation escalates with restrictions to visitation and perceived or actual poor quality contact. There may be increased thoughts of mortality, where an assessment for suicidal ideation should be considered. There's heightened potential for discrimination, treatment bias. Care providers may misread social isolation and loneliness as being voluntary and a preference, and choose to spend more time with people who have the ability for more outward engagement. Restore has engagement features such as center and company-wide leaderboards, helping players see how their game score compares to other players, or simply to strive to achieve their highest score. Providing confirmation that the player is not alone with efforts to exercise and engage can assist with a desire to participate and potentially expand social networks. Family members and friends can be included during a Restore session via video conference and screen sharing, allowing interaction for meaningful encouragement as well as therapist education. Plan ahead to familiarize family and friends with the tools they will need for the video conference and conduct a quick test so that you don't overpromise and underdeliver, leading to a loss of trust. This is a great precursor to Restore at Home, which allows patients who will be returning to the community and their families and friends to continue skill building fun after discharge. Let me briefly touch on workforce challenges. Healthcare staffing challenges are well known. Any additional impact could have devastating effects. Absenteeism due to staff illness, staff restrictions, precautions, or fear-related call-outs, whether it's the coronavirus or severe weather conditions. Resources to provide room treatments can quickly become scarce in an emergency, impacting care provision and reducing opportunities for point-of-service documentation. Staff members will also experience psychosocial issues, reduced confidence, heightened anxiety, and burnout if forced to work extended days and hours. Restore is easy to use, has help features built in, and is intended for skill building support by therapy, nursing, activities, volunteers, and even family and friends of patients and residents under approved circumstances. As Restore is web-based, team members can open tabs with their electronic medical record software for point-of-service documentation as players are resting. Players use controllers which may be disposable or left in the room and are typically positioned 4 to 6 feet away from the screen for infection control considerations. Group play has cooperative, competitive, and turn-taking features, allowing team members to join in for an immersive experience and distraction from psychosocial factors. I hope that you found today's webinar on health risks of social isolation beneficial. For those of you using Restore, I hope you found the information value added in ways that you can use Restore more broadly and effectively. If you are new to Restore, we can help you start now. No new hardware is required. You can typically use what you have. We can remotely open a license for your centers and teams, ship you specialized controllers, provide virtual training and dedicated support. Simply email info@restoreskills.com or call the number at the bottom of the screen, 234-303-0723.